Good morning. My name is Martin with your Navy Wake Up. I am a student practical nurse, and in this video, I'm going to demonstrate the ophthalmic medication administration. For this purpose, I'm using the bed rotation number 1, and I have my MA and I have my doctor's order and the MA. So I'm going to go ahead and compare the information that I have on the doctor's order, make sure that it's the same that I have on my MA. So the doctor's order is for the patient Smith Jones, date of birth October 21st, 1981, and the patient ID is 4322. So on my MA, I have Smith Jones, date of birth October 21st, 1981, and the patient ID is 4322. So we need to administer. So the doctor orders call for the administration of to administer the administration of polysporin ophthalmic solution 2 drops to right eye 4 times a day for 5 days. And on the MA it says polysporin ophthalmic solution 2 drops to right eye 4 times a day for 5 days. And we have even the time on the MA, so which is 800, 1200, 1400, and 2000. So I'll put aside the doctor's order and I'll go ahead now and see my patient to do a assessment and to talk to my patient. Come. Good morning. My name is Martin, and I am the nurse who is going to take care of you today. How are you today? I'm good. What's your name? Smith Jones, October 21st, 1981. So I will make sure. And what's your date of birth? My patient answer. So I'm going to check and make sure that the name I have on her wristband is the same I have on my MA. So Smith Jones, date of birth October 21st, 1981. Smith Jones, October 21st, 1981. I even have the patient ID, which is 4322. 4322. So yeah, so I have the same information. So how are you today? I'm doing okay. So how do you feel? Do you have any pain? The pain is at 0. No, I don't have any pain. Do you have any allergy? No, she has no allergy. And during the assessment, so your blood pressure was at 135/90, which is a little bit borderline high, not alarming, but a little bit high because the normal should be between 120 and 80. The pulse is at 90, strong and regular within the normal range, which is within the normal range of 60 to 100. The respiratory rate is at 22, so a little bit high. The normal should be between 12 and 20. So it's labor fast with wheezes. The temperature is at 36.6. It's within the normal range between 36 and 38. The oxygen saturation is at 89% on room air. Should be between 92 and 100%, and you have no pain, rated at 0 on the pain scale. So you told me that you don't have any allergy, which is good. So the reason of the medication is because you have an infection on the right eye. So they had noticed that you have a sinus infection which has spread on the right eye and the right ear as well. So that's why the reason for medication, the doctor has prescribed polysporin, which is act as an antibiotic. So the goal is to kill the bacteria that are infecting your right eye. So that medication is generally many patients can take them, but you might have some side effects. So effect like stinging, redness of the eye, widening of the pupil, blur vision can occur. So this effect, if it persists or worsen, just let us know and we'll talk to the doctor promptly. You might also have, we'll stop the medication. It's unlikely that you have these serious side effects like shakiness, fast pounding, irregular heartbeat, headache, sweating, weaknesses, or nervousness. But if that happens, just let us know. As well as if you have any redness, itching, swelling around the eye, or any vision problem, we'll stop the medication right away and we'll let the doctor know. So you should note an improvement within the next 2 to 3 days, but we have to continue the medication for the duration that the doctor recommended, which is 5 days. So now I'm going to go ahead and prepare the medication, and I'll be back with the medication to administer that to you. So I'm back here now with the medication. I will take my Ma with me, and I will pull the medication from the drawer. So this is the medication I have. I will do my three checks, 5 rights. So the first check is to make sure I have the right medication, polysporin. The right patient is Smith Jones, October 21st, 1981. Smith Jones, October 21st, 1981. The right dose is 2 drops. 2 drops. The right route is ophthalmic, so it's on the eye, on the right eye, the right time and frequency. So the times are 800, 1200, 1400, and 2000, and the frequency is so it's 4 times a day. So I have that, so that will complete my first check. Now I'm gonna go ahead and take my eyedropper, here, and I will pour the medication with my eyedropper. So I pour the medication now. So I put the medication. I have my pre-made label. So I'll label my medication, but once I label my medication, I'm going to do the second check. So my second check is make sure I have the right medication, polysporin ophthalmic drug. The right patient is Smith Jones, October 21st, 1981. Smith Jones, October 21st, 1981. The right route is ophthalmic, so it's on the eye. The ophthalmic on the eye. The right dose is 2 drops. And the right time and frequency, it's 4 times a day at 8 o'clock, at 800, 1200, 1400, and 2000. 800, 1200, 1400, and 2000. So that completes the second check. So my third check, I will put that on my tray, and on the tray I will perform my third check, which is what medication. The right medication is polysporin ophthalmic drop. The right patient is Smith Jones, October 21st, 1981. Smith Jones, October 21st, 1981. The right dose is 2 drops. The right time and frequency is 4 times a day at 800, 1200, 1400, and 2000. 800, 1200, 1400, and 2000. And the right route is ophthalmic, so drop in the eye. Right route is ophthalmic, and also the expiration date is October 22nd, 2024. October 22nd, 2024. So that completes my third check. So now I'm gonna go ahead and see my patient. Kong, I'm back again here with the medication. Before we go ahead, I forgot to mention during my teaching that you have the right to refuse the medication. So if you're not okay, you have the right to refuse the medication. I will go ahead and do the assessment first of your ear really quick to see really quickly how your eyes look. Sorry, not the ear, the eyes. So I can see that you have a little bit of crust around the ear because I'm touching my patient. That's why I'm wearing my gloves. So I'm gonna go ahead and try and moisture that and remove the crust that are in the inner canthus and around the eyes there. So I'm taking that and I'm gonna wet that a little bit. So I'm here, so I'm gonna put a little bit. I'll make sure not to scrub in order not to scratch the ear, but I'm putting that and I'll wait a few minutes so that it moist a little bit, and they can remove. So I have now cleaned that and removed. I clean from the inner canthus to the outer canthus. That's also very important. Once I finish cleaning, I have to remove my gloves, and I'm gonna perform another hand hygiene and put new gloves because I'm gonna administer medication. So to administer medication, because I'm gonna touch the patient again, I'm gonna wear new gloves. So I'm wearing new gloves. I'm wearing new gloves to administer the medication. So now to administer the medication, so I'm gonna take my medication, and I'm gonna use my non-dominant hand. This will be my non-dominant hand. So I'm gonna take a clean gaze. I'm gonna use this as a clean gaze, and I'm gonna put a little bit here and put pressure. I'll put gently and press downward with my forefinger against the bony orbit. So I'm gonna press gently, and I will expose. The goal is to expose the conjunctival sac. Once I see that I have exposed the conjunctival sac, I'll put my hand over here to stabilize so that the drop will come, and I'm gonna put the drop. I'll bring the eyedropper within 1 to 2 centimeters from the conjunctival sac, and I'm gonna put the first drop. Once I put the first drop, I'm gonna wait a few minutes to make sure the drops goes in, especially just to make sure that she receives the right dose. So after a few minutes, I'll put the second drop, and the excess of medication that is there, I'm gonna clean with my gaze. So that's also important. And if I put more than one drop, as I already mentioned, then in this case I have to wait about 5 minutes after each drop, so and put the second drop. So once I finish putting the drop, so I'm gonna make sure I press a little bit on the conjunctival, the nasolacrimal duct, so just to make sure I will press that, but I will avoid pressing directly on the eyeball. So I will apply a little bit of pressure on the nasolacrimal duct with a clean, maybe fascial tissue. I can use the clean fascial tissue to apply that, and gently and briefly. And after that, I will dispose all what I have. So I will dispose that, remove my gloves, apply hand hygiene, and I will put my patient comfortable, put the handrail up, put the call light, the call duty there, and I'll be coming every now and then to check to check how she's feeling, if there is no allergy, and I will do the medication. I will do the documentation, so the right documentation, by using, I'll take my Ma and feel the I'll feel the medication was administered at 8:15, and I'll put my initial and the date and the time that the medication was administered, and I'll come every now and then, as I mentioned, to evaluate how my patient is doing. Thank you very much. This was the demonstration of the ophthalmic medication administration. Thank you.